Robert F. Kennedy Jr. is taking a battle axe to the workforce for the Department of Health and Human Services. The agency is being reduced from 82,000 workers at the time of Trump's inauguration to now 62,000. That's 20,000 gone. As RFK Jr. said in his official press release that we aren't just reducing bureaucratic sprawl, we are realigning the organization with its core mission and our new priorities in reversing the chronic disease epidemic. This department will do more, a lot more, at a lower cost to the taxpayer. Now, the workforce slashing is half voluntary, and the other half is getting the boot with severance packages. Here's what Robert F. Kennedy Jr. had to say about all of this in a video posted on X.
Hey, everybody. I'd like to share with you a paradox that I've encountered here in Washington, D.C. as the new Secretary of HHS. Our department is filled for the most part with competent, conscientious public servants, and yet the agency has been inefficient as a whole. Over the past 4 years during the Biden administration, HHS's budget increased by 38%, and its staffing increased by 17%, but all that money has failed to improve the health of Americans. In fact, the rate of chronic disease and cancer increased dramatically as our department has grown. Our lifespan has dropped, so Americans now live 6 years shorter than Europeans. We are the sickest nation in the world, and we have the highest rate of chronic disease. The U.S. ranks last among 40 developed nations in terms of health, but we spend 2 to 3 times more per capita than those nations. As Secretary, I now understand why all this money is not improving our health. HHS is a sprawling bureaucracy that encompasses literally hundreds of departments, committees, and other offices. You know how bureaucracies work. Every time a new issue arises, they tack on another committee. This leads to tremendous waste and duplication, and worst of all, a loss of any unified sense of mission. The resulting pandemonium has injured American health and damaged department morale. When I arrived, I found that over half of our employees don't even come to work. HHS has more than 100 communications offices and more than 40 IT departments and dozens of procurement offices and 9 HR departments. In many cases, they don't even talk to each other. They're mainly operating in silos. Sometimes these sub-agencies work at cross purposes with each other. Some of these little fiefdoms, for example, are so insulated and territorial that they actually hoard our patient medical data and sell it for profit to each other. Instead of remedying the chronic disease crisis, perverse incentives have administrators checking boxes and grading their own homework while public health declines. A few isolated divisions are neglecting public health altogether and seem only accountable to the industries that they're supposed to be regulating. In one case, defiant bureaucrats impeded the Secretary's office from accessing the closely guarded databases that might reveal the dangers of certain drugs and medical interventions. I have some good news, though. As part of President Trump's DOGE workforce reduction initiative, we're going to streamline HHS to make our agency more efficient and more effective. We're going to imbue the agency with a clear sense of mission to radically improve the health of Americans and to improve agency morale. We're going to eliminate an entire alphabet soup of departments and agencies while preserving their core functions by merging them into a new organization called the Administration for a Healthy America, or AHA. We have 2 goals. The first is obvious, to save the taxpayer money by making our department more efficient. And the second is to radically improve our quality of service. I want to promise you now that we're going to do more with less. No American is going to be left behind. Our key services delivered through Medicare and Medicaid, the FDA and CDC, and other agencies will enter a new era of responsiveness and a new era of effectiveness. We're going to consolidate all of these departments and make them accountable to you, the American taxpayer, and the American patient. These goals will honor the aspirations of the vast majority of existing HHS employees who actually yearn to make America healthy. 28 great divisions will become 15. The entire federal workforce is downsizing now, so this will be a painful period for HHS as we downsize from 82,000 full-time employees to around 62,000.
Now, did you catch that in the middle of the video? These agencies have been withholding information from each other, selling the data internally, even though they all work for the federal government. They're all part of this one giant pie, but they are competing with each other. It seems to me that it's almost daily now that we get confirmation of yet another outrage that our federal government has been engaging in. I mean, can you believe this? These agencies withholding information from each other for cash? This is an unbelievably terrible idea. They're all supposed to be working for the same person, us, the American people, the United States government. And what's even more maddening about all of this is these aren't different agencies like, the Department of Defense with the HHS. No, these are all departments under the same agency. It's ridiculous. And what makes it even more frustrating is when you dig into this, it's not like these agencies or these departments were going rogue. It was the federal government itself that codified, that created the ability for these agencies and their departments to charge each other fees to share data, or even allowing them to withhold data if the price wasn't right. How could this possibly have happened, is what I'd like to say. But I mean, this is the federal government that we're talking about. Of course this happened. But why? How? Well, it turns out it's not some great grand conspiracy as to how this happened, but instead it is the story of a sad, slow, inevitable creep of unchecked bureaucracy fueled by incentives brought to you by the federal government and Congress. See, post-World War II, agencies like the HHS grew incredibly. By 1953, it was the HEW. They were juggling health, education, and welfare. Data became power. For example, the CMS's Medicare data, the CDC's disease stats, and the NIH's research outputs were each a fiefdom of currency that they could wield. And Congress is directly to blame in all of this. They gave these agencies, they gave these departments autonomy to manage resources, including charging fees. And why, you might ask? Well, because of internal budget fights. Congress didn't want to manage this. And so they allowed them to charge the fees. And over the decades, this stupid decision morphed into a system where data sharing got tangled in red tape or so-called cost recovery rules. And HIPAA added further complexity to this. Agencies could share internally, but often had to lawyer up to avoid breaches, leading to hoarding. I mean, it's one incompetent, ridiculous nonsense after another. And what's crazy about all of this is there wasn't some, mustache-twirling bad guy in the background designing this specifically to creating the ability for agencies to profiteer amongst themselves. It just happened over time naturally. It evolved to prioritize control over collaboration. So thank you, Congress. Thank you, federal government. These federal agencies, including the CMS, the NIH, or the CDC, they can license their data internally. And they do this under the frameworks of the Paper Reduction Act and the Freedom of Information Act. These idiots in government literally created a system codifying fiefdoms internally within the federal government. In fact, it's so bloated, it's so corrupted now. According to Robert F. Kennedy Jr., when he first tried to access the CMS, or the Centers for Medicare and Medicaid Services, patient data, which belongs to the HHS and the American people, mind you, the sub-agencies resisted him. They even tried to charge him for data that he wanted access to. They tried to charge Robert F. Kennedy Jr. to access his own data. The whole thing is maddening. It's crazy. Now, the federal government's size and inefficiency, it's not a secret really to anybody. So if you ask me, despite all the wailing and gnashing of teeth happening from the Democrat Party right now and their willing accomplices in the media about all these dangers of cuts under Robert F. Kennedy Jr., just know that it is quite likely that you could cut the agency in half and not even notice, thanks to all this bloat and waste, just like all the other federal agencies within the government today. This is the best chance that we've had in our lifetimes to see real government reform. All these corrupt advocates can just go pound sand, in my opinion. I don't care about their complaints. This needs to end. This ridiculous, absurd federal government needs to be shrunk dramatically. We need this to be fixed. The government has become so big, so bloated, so Orwellian, that they have become one of the greatest threats to the American citizens today. Think the lockdowns during the pandemic. not to mention the attempt at mandating the American people do things that they may or may not have wanted to do. We have lived through a perfect example of massive government overreach. It amplified to all of us just how dangerous the federal government really could be. So, I, for one, hope that these cuts into the federal government don't stop anytime soon.